Hi, I'm Dr. Tyler Berry with Greater Carolina Clinic of Chiropractic, and I wanted to show some typical adjustments for pediatric care with kids. And today we have a family that we're going to go through and show you what a typical adjustment looks like in our office. If the patient is old enough to where they can lay up on the table on their own, then we have them lay face down pretty much like an adult, and I check out their pelvis and their leg length, seeing if it is in line. Do a light little push, sometimes a drop with the drop piece if they're big enough to the pelvis. It's very light force. Then I use an impulse adjusting tool, which does little clicks. Feels just kind of like I'm almost giving them a little massage or tickling them a little bit with this little gun. And they hardly feel it at all. They just feel these little clicks on the back of their spine as we work all the way up. And I do this with a single prong and a dual prong instrument, where the dual prong is now hitting just on the facet joints on the latter part of the vertebrae. We work our way up the spine, all the way up to the top, which is where the atlas is, meets the cranium. And then I'll have them usually roll over onto their back, and we'll check out their neck, see if it needs to be adjusted any further. Sometimes I can do just a held sustained contact where I'm just holding it. Sometimes there's a little bit of a push. It's not scary. They usually love it. And then I tell them to give them a big hug to themselves. And we just do a little push on their back. And that's it. And they usually love it. I always get a high five afterwards, and they're excited and ready to go for the day. So some of the reasons that parents bring their kids in to be treated, common symptoms would be, sleeping trouble when they're little, some reflux, colic, ear infections, very common. As they get a little bit older, it's more often it can be constipation issues or bedwetting issues, and all these things. There's no specific treatment per se other than working on the spine and the certain areas that those nerves go to, those certain organs that are not functioning properly. But basically we're just getting the brain able to communicate to those organs, and the body functions better, and then it clears up those symptoms that they're having. Often as they're growing up, obviously they're taking a lot of falls, falling down quite a bit, starting to play sports, and they're growing. It's very beneficial just to get their body functioning the best that they can. Most of the time, kids will not present with pain or perceived normal chiropractic issues like sciatica, but those other symptoms are signs that the body's not functioning properly, and that's why we adjust kids. I hope you found this video helpful. If you have any questions, I'd love to answer them for you. Please feel free to give us a call, and we can set up a time where we can go over and answer any of your questions. Our number is 803-788-7890. Thank you, and have a blessed day.